Introducing the DNP Anatomic Dorsal Endoplate from Hand Innovations. The DNP Anatomic allows the minimally invasive treatment of the common extra-articular distal radius fracture. Attach the insertion guide to the implant by using the locking screw in the open hole. Make a 3 to 4 centimeter longitudinal incision overlying the distal radius and in line with Lister's tubercle. Release the EPL tendon sheath several centimeters proximal and distal to Lister's tubercle. Retract the EPL tendon towards the radial side. Carry the dissection proximally to expose the fracture site and the dorsal radius. Insert an 18-gauge needle to locate the joint line. The distal edge of the implant will rest 3 to 4 millimeters proximal to it. Using a marking pen, draw the silhouette of the head of the implant. If necessary, with a rongeur, create a notch on the proximal fragment in line with the floor of the third compartment. Open the medullary canal with the awl. Insert the endoplate into the medullary canal and advance it with a gentle rotational motion. The fixed-angle distal K-wire provides provisional fixation of the distal fragment, as well as peg trajectory targeting for confirmation of correct implant placement. Under fluoroscopic guidance, and while maintaining reduction, insert the 2 millimeter bit through the distal fast guide to create the track for the distal peg. While drilling, push the distal fragment up and against the implant. This will ensure the head is flush with the bone surface. The path for this screw will mimic the placement of the distal K-wire. Carefully measure for length using the telescoping depth gauge, then remove the fast guide and apply the distal peg. Avoid protrusion through the volar cortex, as this may cause soft tissue problems. Drill through the remaining fast guides and insert the next 2 distal pegs. Apply the proximal cortical locking screws next. An optional proximal K-wire can be used for provisional proximal fragment stabilization. Insert the drill sleeve into the center slot on the guide. Drill a unicortical hole with the 3.3 millimeter bit. Remove the drill sleeve and apply a cortical locking screw with the square-ended driver. Repeat these steps for the remaining proximal screws and then retighten all the screws. Drill through the locking screw for the final distal peg. Remove the guide and measure for length using the non-fast guide scale on the telescoping depth gauge. Apply the remaining peg. Do not protrude through the opposite cortex. After proper application of the DNP implant, the EPL tendon should course proximal to the head of the implant and the tendons of the second and fourth compartments on each side of it. There should be no impingement. Obtain final radiographic views. Close the wound with proper surgical technique. Apply a post-operative dressing and encourage immediate finger motion. Hand Innovations, dedicated to excellence in upper extremity fracture fixation, is raising expectations with the DNP Anatomic Dorsal Endoplate.